Welcome to the Therapy Trainings Podcast. I'm thrilled to have you here today as we dive into a fascinating and incredibly important topic for mental health professionals: working with families in addiction recovery. This episode serves as a companion to the course 3 CE Hours Working with Families in Addiction Recovery, offered by Therapy Trainings. Whether you're a seasoned therapist or just starting in the field, understanding how to effectively engage with families impacted by addiction is essential for fostering healing and resilience. In today's episode, we're going to explore some key takeaways from the course, delve deeper into the dynamics of family involvement in addiction recovery, and address some common misconceptions that often arise in this area of practice. You'll leave with practical strategies to enhance your work with families, as well as insight into the broader context of addiction recovery. So, let's get started. First, let's set the stage by understanding the significance of family involvement in addiction recovery. Addiction doesn't just affect the individual, it reverberates throughout the family system. Families can serve as both a source of support and, at times, a source of stress. Engaging families in the recovery process can provide a network of support that is crucial for long-term success. The course emphasizes that when families are involved, it can lead to better treatment outcomes and increased motivation for the individual in recovery. One of the key concepts explored in the course is the importance of family dynamics. Family members often navigate complex relationships that can influence the recovery process. For instance, consider the role of enabling behaviors. Sometimes, family members may inadvertently support their loved one's addiction by providing financial assistance or covering up for them. Understanding these dynamics can help you as a therapist to facilitate healthier interactions within the family. Let's take a moment to think about a common scenario. Imagine a mother whose son is struggling with alcohol addiction. She may feel torn between wanting to support him and needing to set boundaries. During your sessions, she might express guilt about not doing enough for him, while simultaneously feeling angry about his behavior. This emotional push and pull is not uncommon and underscores the importance of addressing family dynamics in therapy. Another vital aspect covered in the course is the concept of communication within families. Effective communication can be the difference between a family that thrives in recovery and one that struggles. Therapists can provide families with tools to enhance their communication skills. This includes teaching them how to express feelings without blame, listen actively, and validate each other's experiences. These skills can foster a more supportive environment conducive to recovery. Now, let's pivot to another crucial topic: the stages of change. The course highlights that family members may not be on the same page when it comes to the recovery process. While the individual facing addiction might be ready to change, family members may still be in denial or grappling with their feelings of anger and betrayal. Understanding the stages of change can help therapists guide families through their unique journeys, ensuring that everyone feels heard and supported. For example, using the trans-theoretical model of change, you can help families identify where each member is in their process: pre-contemplation, contemplation, preparation, action, or maintenance. This understanding can facilitate more compassionate interactions and can help family members recognize that they are all part of a larger healing journey, even if they are at different stages. Now, let's address some common misconceptions that often arise when working with families in addiction recovery. One prevalent myth is that family members are to blame for the addiction. While famille dynamics can influence addiction, it's essential to understand that addiction is a complex disease with various contributing factors, including genetics, environment, and individual psychological issues. As professionals, we must help families understand that their loved one's addiction is not a reflection of their worth or parenting skills. Another misconception is that once the individual in recovery has completed a program, the family's work is done. In reality, recovery is a lifelong process. Families need ongoing support and education to navigate the challenges that may arise post-treatment. The course emphasizes the importance of continuous family engagement and offers strategies for integrating family sessions into ongoing treatment plans. So, how can you apply these insights in your practice? One effective approach is to create a family support plan. This plan can outline ways in which family members can support their loved one's recovery while also taking care of themselves. Encourage family members to attend support groups like Al Anon or Families Anonymous, which can provide them with valuable resources and a community of understanding. Additionally, consider incorporating family therapy sessions into your practice. Family therapy can facilitate open dialogue, address conflicts, and provide a safe space for family members to express their emotions. This can be particularly helpful when addressing issues like resentment, guilt, or fear that may be preventing the family from moving forward together. Let's take a moment to reflect on the power of stories in the therapeutic process. Sharing success stories of families who have navigated the recovery journey can be incredibly inspiring. For instance, consider the story of the Johnson family, who faced the challenges of their daughter's addiction head-on. Through therapy, they learned to communicate more effectively and set healthy boundaries. Over time, they became a source of strength and support for their daughter, and today, they celebrate milestones together as a united family. Stories like this remind us that recovery is not just about the individual, it's about the entire family system. It highlights why it's so critical to involve families in the treatment process. As we wrap up today's episode, I want to encourage you to continue expanding your knowledge and skills in this vital area of practice. Working with families in addiction recovery is not just beneficial, it's essential for fostering healing and resilience. If you're looking for further resources, I highly recommend checking out the course FOS 3 CE Hours Working with Families in Addiction Recovery, offered by Therapy Trainings. Their commitment to providing quality education for mental health professionals is truly commendable. Before we conclude, I want to leave you with a thought-provoking insight. Every family has the potential for transformation. While the road to recovery may be filled with challenges, the opportunity for growth, understanding, and connection is always present. As you engage with families in your practice, remember that your role is not just to guide individuals, but to empower families as they navigate their healing journey together. Thank you for tuning in to this companion episode of the Therapy Trainings podcast. I hope you've gained valuable insights that you can apply in your work. Don't forget to visit therapytrainings.com for more courses and resources to enhance your practice. Until next time, keep supporting families and fostering healing in the world of addiction recovery.